So it is amazing that statement, right? A little pain and then you get the pleasure from behind that.
Yeah.
This is definitely leaning into that space.
Hello, welcome to another episode of Finding Peaks. I'm Jason Friesma, hosting today, and I'm really excited to have joining me Rebecca Axton, LPC, LAC, Clinical Supervisor at Peaks. She's been with us for 3.5 years, I believe. And I've asked Rebecca to come in today to talk about Acudetox, which is a treatment modality that we offer here at Peaks. And it's a little bit interesting. Yeah.
It's kind of fun because I usually get to meet the clients for the first time when I'm actually like, hi, I'm Rebecca, and I'm going to be sticking you in your ear today.
Yeah.
To help you relax.
So, yeah, walk us through what Acudetox is. We have an ear here on the table.
Right, I brought some props for us to go over, but Acudetox actually is Chinese medicine or Eastern medicine that has come in contact with Western medicine in 1974 with Dr. Michael Smith. Kind of put this into play. It was actually designed to help individuals with their withdrawal symptoms from substance use and alcohol withdrawal. And then they found out as they kept going through this that it actually helps to bring connection with self and to relax you, so you're able to mitigate symptoms of anxiety, depression, those types of things. We've had some really phenomenal results with it in Peaks.
Yeah. So I always zoom in on these types of responses. Like, what does connection to self? Like, how does that show up when you put little Acudetox needles into somebody's ears?
Yeah, so we actually just go right into 5 specific locations for the NADA protocol, which is National Acudetox Association. Per their protocol, we go into 5 connective points within the ear, and I brought this prop here. One of those being the sympathetic nerve connective area, which is actually associated with your amygdala and your fight, flight, or freeze. So we stimulate that connective tissue to help relax the body. I know it seems kind of an oxymoron, right?
Yeah.
That you would put something into a space that is normally helps you to have anxiety so that you can fend off things.
Especially
to relax that space. Yeah, exactly. So we do that. We also do the Shen Men area, which helps to bring that connection to self and your world around you. It's the spiritual connection, if you will, to yourself. Then we go in the kidney, and the liver, and the lung. Most of the time those are filters, and they also help you to kind of relax and helps to process. It brings that stimulation through the connective tissue that we puncture into, creates a stimulation through the body. So people actually have reported that they can feel the sensations running through their body. It's not a guarantee, but I have had that report with quite a few people, that they can feel the sensations running through their body, that something is actually happening. And with those signals that run through the body to the brain, it helps to bring in molecules from the body to produce sedation and relaxation.
Okay.
And thereby they have this connection to themselves. I've found that a lot of our individuals coming in with trauma, it's the first time that they've allowed themselves to really relax. Which is odd. So we do create this nice quiet space for them to be in, that they are able to find this relaxation, because that's what calms the nervous system down as well. And then with this treatment that helps that with blood flow and all of these healthy molecules running through the body, it creates this nice relaxed space for them in which to heal.
Do you find that people get pretty nervous going into this? And I guess probably a question you get is, does it hurt?
Yes, yeah. I get that question a lot, and I can't say it's pain-free, but it's not painful. There is a small pinch upon the insertion of the needles because we actually do use real needles. They're really tiny, about the size of a hair, and so they just go right underneath the dermis, right into that connective tissue. So there's a little small pinch, maybe like an ant bite, if you will. And then after that, there shouldn't be any pain, pressure, discomfort. And if there is, we just move it a little bit to allow that connective tissue to either grab hold or relax that. And then they don't feel anything.
Okay. So I participated as a participant, I guess, with auricular therapy or Acudetox a couple times. And I certainly noticed, like, particularly one spot would hurt more than others. And then within a period of time, like, they begin to fall out. Yeah. What is that about?
The reason they do fall out is you could have hair that pulls on the needles, that pulls them out. If somebody is, your ears are hairy. Well, the hair from your head. The hair pulls it down. So I usually have people either pull their hair back, or I will pin it back with some bobby pins or whatnot, so that the hair is not the point. If they tend to chew gum or eat something, which we, try to avoid that, because the movement or the movement of the jaw can actually wiggle those out, because your skin moves when your jaw moves. Most of the time, it's the connective tissues, the vibration within the connective tissues and the heart rate that puts pulsations on the needles, and then will tend to push them out.
Oh, okay.
It doesn't mean that there's something wrong with that particular area of the body. It's just functioning at a higher level.
Okay.
So those vibrations, that signal through the body, can push the needles out. I have seen them just drop out, and then I have seen them like shoot away from someone, which is kind of fun, because people, are taken back when that happens. But really, it's just a normal function of the body to push things out of the body.
Okay, that makes sense. So what have you seen? Like, walk me through maybe a typical or, a good example of how somebody detoxing maybe from alcohol and they're on day 2 or 3, and you do Acudetox. What do you see with them? What do you notice?
Usually there's a bit of nervousness up front, and then we just simply walk through very, very slowly what the process looks like. I use the guiding tubes on the needle, so I'm not freehanding it into the ear. Less chances of double sticking someone with their own needle. But we will place the needles in these specific areas, and then we will simply have them rest for between 35 and 45 minutes. Okay. With the needles in place. I play some nice spa type music, nothing with words, because you do kind of get into that hypnotic type of state, where you're right before you fall asleep, in that kind of floaty space. So that you're just aware of what's happening with your body.
Okay. Yeah, and then people who are detoxing aren't usually feeling very floaty in that way. They're usually quite aware that they are uncomfortable.
They are.
Yeah,
and it's interesting, because I've had more people than not really relax into this space. Again, it's typically the first time that they've, in many, many years, had an opportunity to just really relax. And then we have the people that just don't like needles at all. They're like needle phobic, needle aversive, for whatever reason. And so we put on these acupressure seeds, which is a Vicaria seed, a flower, stuck on surgical tape. And we have both the skin tone and the clear that I use. So you, depending on your skin tone, right, you don't see the tape necessarily on the skin. But this applies the same theory behind it. It just is a pressure on that same connective tissue, so it takes longer to work. These can stay on for several weeks. I don't recommend any longer than 10 days, because the surgical tape gets really tacky after 10 days. And so they fall off, they slough off with normal skin wear and tear and washing and oils on the skin, or they can simply pull off. We do this once a week for our clients, and so if they still have the seeds on when we come back around to do this, I just simply pull it off, clean the ears, and we start again. But it has the same kind of theory. That pressure on the connective tissue sends the signals through the body, creates the movement within the body, which then creates the relaxation in the...
Yeah. So obviously, this is called Acudetox, and as it implies, it's like acupuncture or pressure to help somebody detox. What about people coming in with depression or anxiety or PTSD? I know this is also called auricular therapy, which auricular I think just means having to do with the ears. Yeah.
Ear therapy.
Ear therapy.
So if you look at my nice big ear, we think about this as an entire body system. The head being here, if you think of this as a fetus, right, and turn it upside down. So you have the head, the spine, the internal organs, and the hands and the feet are all folded up under here. So we can get to the entire body system through the ear. But we do, again, with the NATA treatment, we do specific spots in the ear that have been identified as creating that same connection and relaxation. But we've had some really great luck with using
what does that do for somebody with depression or anxiety?
Yeah, well, it creates a calmness within them. So by stimulating that sympathetic nerve, it really does relax that fight, flight, or freeze modality where somebody gets anxious. So it creates a space of calmness, relaxation. It helps with sleep. I don't know if this is going to be appropriate here, but I did this with my husband after his, he had some kidney stones and was having some issues. We used this treatment a couple of times to help him with that, to help him relax and move through that space of the discomfort and pain that he was going through. Worked really well for that. It can decrease anxiety and agitation within someone through this stimulation process. So it is amazing that statement, right? A little pain and then you get the pleasure from behind that.
Yeah.
This is definitely leaning into that space.
Yeah, I find it interesting that, I mean, you're a therapist, Rebecca, and you're doing acupuncture. Did you see yourself doing this at some point? Or when did you kind of stumble into auricular therapy?
Well, at my heart, I am a trauma therapist, and so I was looking for all avenues trauma related to help people move through their trauma, and this particular method popped up in that. So I did the extensive training that was offered, and again, I was a little skeptical at first because how could puncturing somebody in the ear really help them to relax? But ancient Eastern medicine, welcome to the Western world, it actually does create this space. Now, while it may not work for everyone, I have found over the years that this is really a good modality for individuals with trauma. It can help them to relax so that they're able to talk and process. It helps people to relax and journal. It kind of frees up that space that's blocking them, if you will, so that they're able to process more of their trauma story.
Okay. Have you seen people be kind of skeptical of it and it still work for them?
Oh, 100%.
Okay.
Yeah, 100%. Because, once they start feeling things in their body, they know something is up. I'm sure that people who are resistant to this type of medicine can continue to be resistant, but that doesn't mean that it's not helping them.
Yeah. Can you kind of, without necessarily citing what the studies are, but what do studies show about this? Like how this is an evidence-based practice, correct?
It is, yes.
What is the evidence that you kind of reviewed as you were learning this practice?
This is also one of a government-sanctioned kind of process for trauma for those individuals, first responders. I work with FEMA as well, kind of on the side. As an emergency medical practitioner in going to emergency sites, fires, earthquakes, floods, those kinds of things. And we'll set up an Acudetox area for people who are experiencing this trauma, for the first responders, for the citizens that come in, which is really nice.
Yeah, so even that acute trauma that's going on in real time, that's helpful with that.
Yeah.
And yeah, so how did this end up in 1974 coming here? Like, was it research? Was it kind of trying to find solutions for people who are suffering? What do you know about the research behind?
There is quite a bit of research, and I didn't bring all the research, but there are a lot of articles out there about the process for Acudetox. Again, Dr. Smith in 1974 brought this over and kind of made it a widely available modality for trauma therapy. and detoxification,
Yeah.
which is where he started at.
Okay. And then being mindful of HIPAA and that sort of thing, do you have any stories, like anyone who is like, okay, as this person was leaving treatment, they really came and said the Acudetox really helped me? Like, do you have any stories of how this has helped, and maybe that could help illustrate what the type of people this can help with?
Yeah, several stories that come to mind, right? When we have resistant individuals, it's like, oh, I'm not doing that. I mean, how does that help?
Yeah.
So they will resist for maybe a week or so, and then they'll see a dozen or so other people around them actually move into that nice, relaxed, quiet space, and then talk about, because I allow people to talk about it after the process. What are they feeling? What do they notice? What changes have taken place? So they'll start talking about that. And then the next week that we do this, the individual will come in and maybe they want to try acupressure, not necessarily Acudetox. And then the week after that, then they want to try the Acudetox. So we go nice and slow, one needle at a time. We breathe through it until they can get there. We had a recent intern who was needle phobic, and she, after a couple weeks, she started doing this, and we actually helped her kind of mitigate her needle phobia by using Acudetox of the ear.
Okay.
Because the thought of having needles in your ear was more of a pressure for her, or for other individuals as well, than the actual process itself. So we helped them kind of move through that needle phobia, which is always fun for me.
Yeah.
To see people actually become brave enough to give it a try, because they've never imagined themselves being around a needle before.
Right.
And so here they are sitting amongst their peers who all have 10 needles sticking out of their ears.
Yeah.
Yeah.
Okay, and in all your years and hours of doing this, have you seen any negative reactions other than people just not wanting to do it?
No, it's really just that. I have had, I think, one individual who had bumble ear pretty bad, wrestler in your world.
Okay,
So
yeah.
those of you who have that cauliflower ear, bumble ear, is a lot of cartilage development in the ear.
Yeah.
He had a pretty negative response just because it was painful for him.
Okay.
And we couldn't find a space. So he got fairly angry, but we removed it right away. There was no other negative side effects from that. But for the most part, I've done thousands of these Acudetox treatments without any negative reactions.
Okay.
Yeah.
I mean, it's rare that, I don't know, numbers can be that good, but I mean, from the outside looking in with how you practice this with our clients, like it does seem to be helping regulate people's nervous system, and obviously coming into a treatment program like Peaks, it's a stressful situation and it's very difficult, and this is kind of a wonderful tool we can offer, well, really everybody that is willing to maybe step outside their comfort zone. And some people I'm sure are very comfortable with and have a lot of experience with acupuncture in the past, but this is a very beneficial intervention for sure. Do you know if this field is going anywhere? Like, is there an expansion? Are you adding new areas that you're targeting? Is this?
The NATA protocol is strictly these 5 points.
Okay.
Acupuncture does allow, there's over 120 acupressure or Acudetox points, acupressure points within the ear structure, front and back, that can be targeted. So if you have back pain, lower back pain, you can simply target that area. If you're having issues with sinusitis, there's an area for that. There's also some layouts for if somebody has a migraine. That's quite a few more points combined to create this relaxation for the migraines and the headaches. And if you have problems with your ankles or your feet or your hands, within this there is a spot for everything.
Yeah.
That you can target. But it's really fun. I have found over the years, right, what I see, because I do our men on Friday and our women on Thursday, is that they will like talk to each other about this upcoming thing, and they get really excited to see me because they know what day it is.
Oh, yeah.
It's like, yeah, Friday, and here she comes, and they will run from group to group to come in for their Acudetox treatment. They want to be the first one in, they want to get their seat prepared so they know they can relax in that space.
What I think it is the beauty of what you have to offer is obviously it helps people early in their treatment process when they are really kind of amped up about being at peaks. But we also, with how our curriculum is laid out with it being kind of week-long intensives, like it's a nice kind of end cap to a week where people can kind of do deep and intensive work and then have this to look forward to kind of like begin to settle their nervous system after maybe going through grief or other trauma issues and that sort of thing.
Yeah. And I think it speaks to itself in that, because we do some pretty good intensive work where people get really deep and emotional, and this allows them to really notice the emotions without getting overly or overwhelmed by them in this space.
Absolutely.
Yeah.
All right, well, with that, Rebecca, I think we'll go ahead and wrap up this episode. I'm really grateful for you to come on. I really appreciate you bringing props and this oversized ear that doesn't have any hair in it, and the needles and everything like that. And with that, I'll go ahead and sign off. So thanks for viewing.
Yeah, come join us. I look forward to setting you up with Acudetox as well.